My name's Andrew Jameton. I teach here on a university faculty in a college of public health. My interest the last few years has been in climate change. With regard to public health, climate change is very bad news, and as the decades go on from here, very likely to be even worse news. There are obvious problems related to forest fires, storms, blizzards, high winds, tornadoes, hurricanes, droughts, and floods, which we need to worry about the health problems of. There are other sort of less obvious effects, such as extended growing seasons with asthma and allergies. At the same time, climate change is very likely to affect two profound factors in health. One is agriculture. It's likely to be damaging to agriculture most everywhere. And the other is that it will lead, with poor agriculture, to more migration, immigration, refugees, and so on, which means that we'll have a lot of people moving around the world, which is usually doesn't work out well in terms of public health. So there are many, many risks. We know what they are. We don't know the degree. We do know that if climate change is allowed to develop, these matters will become more and more serious, and by the end of the century, be quite catastrophic. There are some good things we can do. Win-win sorts of things. One is find ways to lead more healthy lives in this area while at the same time cutting the energy costs of what we do. Bicycles, walking rather than cars, using less air conditioning and heat, toughen us up over the years as we learn to adapt to these things, eating less meat and more local foods with less transportation and so on. So those are easy, helpful, and they go along with other sorts of things that may be good news. For instance, if we look at countries that are healthy at low energy cost, there are a number of them, and this is way less energy than we use here. So we don't have to replace all of the fossil fuel energy in order to have a healthy society. Only part of it, maybe a third. The other connection is that if we want not only to lead healthy lives ourselves, and we want our children to be healthy and our grandchildren, then we would care a lot about climate change, because as time goes on, it will be worse for our children and even worse for our grandchildren. So the only real course for public health is to mitigate it. So if you care about health, then you care about climate change. Similarly, if you're interested in climate change, then you would be interested in healthy ways in order to cope with it. So among the other kinds of disasters that climate change is a health disaster, and that should motivate us to mitigate climate change through cutting our use of fossil